Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about primary care physicians, specifically the family and general practitioner. And I'm going to give you a job overview, talk about the education requirements, and also give you detailed salary statistics so you can know exactly how much these individuals make on average. Okay, so what does a primary care physician do on a daily basis? Well, this is your go-to doctor for a wide variety of healthcare services and treatment options. And these doctors will typically be your regular doctor, the one that you will see as a first line of defense for a lot of health issues, and you'll typically have a long-lasting relationship with this type of doctor. In fact, some family practitioners will see individuals from the time they are young infants or toddlers all the way up until adulthood. Now, some of the daily tasks that this type of doctor will do, they will do preventative screenings and physical exams where you'll come in and they'll check your lungs, they'll do maybe your blood pressure, withdraw blood and check your labs and things like that. They'll do preventative screening sometimes, like a breast exam, testicular exam. They will also make sure you're up to date on all your immunizations and administer those when necessary, and also help you stay in line with all of the proper screening schedules. For example, when you reach a certain age, you need to get a colonoscopy and so forth. They'll help you make sure that you're getting all of those necessary screenings. They'll also be your first line of defense whenever you have any kind of a health issue. So let's say you get a sinus infection or a respiratory infection, or you're having a really bad stomach ache or some issue like that. Probably you'll see your PCP first, and if they feel that it's something that needs further exploration, they will usually refer you to a specialist. Now, what are the education requirements to become a primary care physician? Well, generally you're going to have 4 years of a bachelor's degree, another 4 years in medical school, and then you're going to have between 3 to 8 years in residency for doctors in general. The good news is, though, with primary care physicians, that's usually on the lower end of the scale, and it usually only requires about 3 years of residency in most states and in most areas. Now, once you complete all those education and residency requirements, you will have to sit for a state licensing exam and maybe even a practical exam, an oral exam or something like that. So those are the education requirements. Now let's talk about salary information. Now, I got all these figures. These are averages, and they come from the Bureau of Labor Statistics, which is the government agency that tracks and maintains job information, and that they're good as of 2014, okay? So what was the average salary for a primary care physician in 2014? $89.58 per hour was the average, and $186,320 per year. A lot of people are often fascinated with these salary figures, and you have to keep in mind that a lot of things can affect your salary, like the state in which you live, the industry in which you work, the number of years of experience you have, and so forth. So let's talk about some of those factors right now. The industries with the highest level of employment were as follows. Offices of physicians came in at number 1 at $193,170. General medical and surgical hospitals came in at number 2. The average salary there, $176,720. And then outpatient care centers came in at number 3, $194,110. Okay, now let's talk about some of the top paying industries. What industries out there paid the most money for this type of doctor? Well, medical and diagnostic laboratories came in at number 1 at $230,050. Management of companies and enterprises came in at number 2 at $223,380. And then residential, intellectual, developmental, disability, mental health, and substance abuse facilities came in at number 3 at $212,190. Now let's talk about the states. What were the top paying states for this profession? Hawaii came in at number 1, $231,110. Alaska came in at number 2, $228,340. And then Georgia came in at number 3 at $223,710. The lowest paying states were Oklahoma, number 1, $136,990. Vermont came in at number 2 at $147,070. And then Missouri, number 3, $149,430. Now, I'm going to try to have an article up on our website within the next day or two, so you can check the link in the description below if you want to see the salary information for all 50 states. So that's a little bit about primary care physicians. I hope this video helped you. In a future video, I'm going to be talking about the different nursing types and the salary information that goes along with that. And I'm also going to do a video talking about salary figures, because people are often surprised at how much of a difference there can be between states and so forth. And I'm just going to kind of show you how you want to factor several things in, such as the taxes and all that, before you just up and run to another state just based on salary alone. So thank you so much for watching, and have a great day.